Good afternoon. I'd like to welcome everybody to this pep talk this afternoon. Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include the names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk. Reminder, after the pep talk, please take the online Learning Com evaluation test exercise for mastery of learning and have a perfect score to get a certificate like this one shown here. The link, I placed the link in the chat box. Another reminder, obtaining 50 OLETE certificates will entitle one mentee to a voucher for a ROJoson telemedical consultation. Another request, please type in your feedback in the chat box during the open forum and before we adjourn. Thank you. So let's now have a group picture taking before we start the pep talk proper. One, two, one, two, three. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. From October 23, 2021 onwards, I've been tackling health disorder and health issue courses. This may take 3 years or longer depending on our enthusiasm and disciplines and perseverance. We are now on our 3rd year, actually. My pep talk today is entitled Breast Cancer Awareness Month for October this month, 2023. The empowerment objective is for the lay people to have an awareness of or understanding of the fundamentals and generalities of breast cancer in their health management. The contents of this particular pep talk will be the following. When is the Breast Cancer Awareness Month in the Philippines? What are the objectives of this month? How do we observe Breast Cancer Awareness Month? Both you and I, or me. What are the ROJoson specific contributions to Breast Cancer Awareness Month in the Philippines in 2023? What are the objectives, target impact, target outcome of the ROJoson PEP Talk on Breast Cancer Awareness Month? What are the focus contents of ROJoson PEP Talk on Breast Cancer Awareness Month, which I will give you an outline later on. And then we will have recognition of the ROJoson breast cancer survivors. Start with the first topic. When is Breast Cancer Consciousness Month in the Philippines? October of each year is being observed as the Breast Cancer Awareness Month. And we know that now is the month, we are now in the month of October. So this observation is not only in the Philippines, but also all over the world. It started in 1985 in the USA, then over the world, as the breast cancer is the most common cancer worldwide, all over the world. The pink ribbon is an international symbol of Breast Cancer Awareness Month. So wearing a pink ribbon is a manifestation of your support of the breast cancer awareness, having and promoting awareness of the importance of controlling breast cancer as a health problem in the community and in the world. What are the objectives of the Breast Cancer Awareness Month? Basically two: to raise awareness and then to empower the lay people on breast cancer in terms of what is it, how to prevent if possible, how to recognize early and how it's gonna be treated and what is the prognosis, etc. Also, to raise awareness and empowering the people on the burden of the breast cancer, okay, and how this can be controlled in the family and community. So the objective is to lessen the number of Filipinos dying and suffering from breast cancer because of late consult and treatment. So we will continue to use the 4Ks of patient's empowerment. Kaalaman means knowledge and understanding. Kakayanan, capability. Karapatan, rights. Kapangyarihan, self-determination. How do we observe Breast Cancer Awareness Month? Both you and me. First, kayo, make an effort to know what is breast cancer, how to prevent it if possible, how to recognize early and how it's being treated, and the prognosis. So try to read, attend lectures and talks provided by DOH and other agencies, and my pep talk today. Examine your body for a possible breast cancer. Do a breast self-examination of your breast, and then consult a physician for a check if you have symptoms for breast disorder or breast condition. Okay, so if you do all these things that I mentioned here, you're empowering yourself, you're contributing to the goal of the Cancer Awareness Month. You will try to lessen the number of Filipinos suffering and dying from breast cancer. As for me, what will be my specific contribution? My specific contribution will be this pep talk on cancer awareness. Okay. So I will align my pep talk with the objectives of the National or Department of Health program. However, I'll try to make my pep talk down to earth, reasonable, simple, and practical, cost-effective, and efficient, and hopefully to better achieve the impact of the National or DOH program. I will try to target at least 10 Filipinos who will pass the OSIL Olete on Breast Cancer Awareness Month. This will serve as one of my key performance indicators for my contribution. So may I request please take and pass the Olete. So at least 10 people, 10 Filipinos will be will be taking advantage of the Olete. Okay. So my objectives will be the following: to create awareness among the Filipinos on breast cancer for those who are still not aware, and to create more awareness for those who are aware of this, because most of you have attended this lecture before. And at least the following: what is breast cancer, how to prevent, and how to recognize, how to treat, and what is the prognosis. So this awareness, as I said, will be measured by the Olete. So please take the Olete exam. And then I will try to promote early diagnosis and treatment in my pep talk. My target outcome will be at least 10 Filipinos are empowered based on the Olete results. So let's now go to the next topic. What are the focus contents of the ROJoson PEP Talk on Breast Cancer Awareness Month for the Filipinos? So this will be the content. What is breast cancer? What are the causes, ways to prevent, behaviors of cancer, when to suspect one may have breast cancer, how to self-screen for breast cancer, how to do self-examination of the breast, what are the consequences of breast cancer if not diagnosed and treated early, what cost-effective diagnostic tests are usually being done for breast cancer suspect, what are the usual treatment, what is the prognosis for majority of the patients with breast cancers and with early treatment. What is breast cancer? It is a cancer originating from the breast. It's a medical disease when some of the breast cells grow uncontrollably with the potential to invade the local adjacent tissue, like here. It's invading the local adjacent tissues on the breast, okay, and also with the potential to spread to distant tissues or organs like the lymph nodes, like the liver, the bones, and the lungs, and also the brain. A breast cancer is usually a solid tumor, not a liquid tumor like leukemia. It is also known as breast malignancy or malignant tumor of the breast. These are other terms. Okay. This is to differentiate it from benign tumor, which does not invade and spread. Breast cancer is the most common cancer in the world, worldwide, sa buong mundo, and in the Philippines also, as of this data, 2020. It is more common in females than in males at the proportion of 100 to 1. So mind you, there are also breast cancers in males, but it's very rare. It is more common in the older than younger females, usually 40 years old and older. There are so many types of breast cancer, and not all breast cancers are the same. There are at least more than 20 different types. Some have track records of being fast growing and some slow growing, and therefore associated with a good prognosis or outcome. Up to the present time, the exact cause or mechanism of cancer development is not yet known. Sad to say, okay, unfortunately. But so realistically speaking, there is no really known absolute way of prevention kasi wala pang eksaktong kaalaman sa cause, exact cause. So in 90 to 95% of cases, nobody knows the exact cause, as most of the time, the cause is also multifactorial, maraming factors that come into play. And in only 5 to 10% of breast cancers, these are due to inherited gene mutations or parang hereditary from the parents. Okay, only 5 to 10%. Majority are not. And this non-hereditary cause are usually called sporadic cancer. Sporadic cause in 90 to 95% of cases. Breast cancer developed through multiple factors such as genetic predisposition, that's one. The other factors will be environmental factors, including lifestyle and aging. That it is difficult to identify a sure-shot specific strategy of prevention kasi maraming factors involved. There's something that can increase the risk for cancer that we cannot change. So this include things like the damaged DNA inherited from the parent. Yung mga genes natin, mahirap na palitan. Then family history, again, mahirap din palitan, mahirap i-control. And of course, getting older, tumatanda. No? Though managing certain controllable risk factors such as diet, physical activity, and other lifestyle choices can lower your chances of developing breast cancer because there are other risk factors for breast cancer which are controllable, so this should be controlled. But again, to be honest with you, there's no guarantee, so just best effort. So these are the uncontrollable factors: females, sex, hindi, wala tayong magagawa dyan; aging, wala rin tayong magagawa; family history of breast cancers, history of breast cancer on one breast, and inherited breast cancer genes from the parents. So these are the factors that we cannot control. Now, but for the controllable factors, which we can do something about, being overweight and obese, lacking adequate amount of exercise, drinking alcohol excessively, using hormone replacement therapy, smoking, then exposing to excessive radiation, particularly to the chest. So we try to control all these things so that hopefully we can prevent breast cancer. Cancer prevention, mitigation tips on controllable risk factors. These are some of the tips. Maintain a healthy weight, adequate amount of exercise, drink alcohol in moderation, limit use of hormone replacement therapy, especially those who are in the menopause, avoid exposure to tobacco smoke, avoid excessive radiation exposure, eat healthy diet, more on the plant-based diet, and be in touch with reliable medical information on breast cancer risk and prevention. What are the behaviors of breast cancer? Once a breast cancer develops, it has the potential to grow and invade and infiltrate adjacent organs, and also the potential to spread to distant sites in the body, like the lungs, the bones, the brain. The rate of growth and spread of the cancer is dependent primarily on the behavior of the mutated gene, which we cannot really predict. Secondarily, on the presence of promoting factors in the person's body like medications, hormonal levels, and in the environment like the cancer-causing chemicals. So once a cancer breast cancer develop, it has, as I said, potential to grow and invade the adjacent tissue. Parang ito, kinakain na yung katabi ng mga tissue. Okay. So pumutok na nga yung sa skin, no? At kinakain pa yung kabilang sa adjacent tissues of the breast. And the most common regional site of spread is the lymph nodes. When you say regional site, dito lang sa lugar na ito, distant means mas malayo. Okay? So distant site will be the bone, the lungs, the brain, and the liver. As of now, usually based on statistics, ang pinaka-common site of spread will be the bone, but usually there are also multiple. Okay? Liver, very uncommon, pero pwede. When to suspect one may have breast cancer? So these are the alert signs or symptom cues for breast cancer. Number one, a breast mass once present will make you suspect that possible breast cancer siya. No? Then change in the breast contour, nipple retractions, nipple areolar skin erosions, nipple discharge, particularly one that is red, and then armpit mass. Usually it signifies a spread from a mass in the breast, lymph nodes usually. So pain per se without the above associated alert symptoms is not a symptom cue for breast cancer. Pag pain lang, usually pag walang bukol, usually walang problema yon. No? So the commonest starting point in suspecting breast cancer is the palpation of a mass on the breast. Pag may bukol, we start talking about, is it cancer or is it not cancer? Although, fortunately, not all breast masses are cancers, but the presence of a mass is always a red flag. This has to be evaluated by a breast surgeon right away. So, once you have a breast mass, or the first thing that you have to remember is that when you do your examination, breast self-examination, and when also the doctor do your palpation, does palpation of the breast, okay? So you have to look for a dominant mass. A dominant mass is a real mass, the mass which is considered as the red flag, meaning if present, it needs at least more investigation. That is meant by a red flag. So one should distinguish dominant mass from prominent or unsmooth breast tissues, yung baku-baku lang, hindi makapal lang, which are usually part of fibrocystic changes, which is considered normal and does not require surgical treatment. So ito yung illustration of the dominant mass on the lumpy breast. Sa lumpy breast, usually hindi lang pantay yung breast surface, bukol-bukol lang. Okay? So this is normal. This is part of fibrocystic changes, which we call, medical term, we call it fibrocystic changes. No? Pag may dominant mass, parang dito, yung area of abnormality nag-stand out, stood out, okay, and different from the surrounding tissue. Yan ang dominant mass. Ito yung magiging red flag. Okay? So diagnostic algorithm in patients with a dominant breast mass. Pag may nakapana kayong dominant breast mass, first thing to do, the simplest would be to look for signs of inflammation. Kung may signs of inflammation, right away your diagnosis is inflammation. So that's a good sign. At least it's not cancer. Now, if there are no signs of inflammation, we start thinking whether it's cancer or not. Okay. Then we first look for the signs of malignancy. Okay. Madali lang with the things that I mentioned earlier in the alert signs, madali lang ma-recognize yung mga signs of cancer. Kung merong just one sign of cancer is present, then we think of cancer right away. Kung negative, wala kayong nakikita, then you can be not assured, but at least medyo kampante kayo, baka benign siya. Okay? So here is the diagnostic algorithm again. First thing to look is for the signs of inflammation and infection. Kung may pus, may erythema, meaning redness, mapula, tenderness, then flactuancy of the mass. No? So yung medyo parang may tubig, may nana, no? Okay? So if present, the diagnosis is inflammatory or infectious mass. So wag na kayo matakot na breast cancer siya. But you still have a problem. You have an abscess to take care of. No? Parang ito, you can just try to imagine medyo malambot itong lighter part of the skin. No? Okay. So pag binuksan yan, nana ang lalabas yan. At makikita niyo mapula dito sa side of the mass, mapula-pula. No? So once you see redness and then may fluctuancy and then merong masakit na masakit ito, usually nana yan, nana. Then after that, kung walang signs of inflammation, we want to look for signs of malignancy. Ito yung mga signs of local invasion, no? Ill-defined border, yung border niya, kita mo, parang sumisingit sa tabi-tabi, no? And then fixation, di siya gumagalaw, retraction, ayun, parang hinuhugot, no? Then ulceration, and then fungation, yung mga lumalabas dyan. And then you also look for signs of spread. No? So first sign to look for would be the signs of invasion, and then this second sign will be the signs of spread to the axillary lymph nodes sa kilikili. Kung may bukulani sa kilikili at meron kang bukol dito sa breast mo, then you suspect cancer already. Ito yung example of a mass on the kilikili. No? Okay. So always combine your breast self-examination with the palpation of the axilla, kilikili. Not only the breast, usually in-examine pa rin yung kilikili. Now, if no signs of malignancy, no signs of inflammation, medyo kampante tayo, most likely it's benign. No? Okay, usually ito. More so if the mass is cystic. Pag pinipindot natin, parang may tubig, then we call that a cyst. No? It contains fluid. How to self-screen for breast cancer and how to do breast self-examination. So breast self-examination should be done monthly as much as possible. If you forget, the next day, kung meron kang time scheduled for the monthly breast self-examination, just do it the next day. Okay. So look and feel for anything unusual. Look and feel for a dominant mass. Look and feel for the other alert signs of cancer like change in contour, nipple retraction, nipple areolar erosion, nipple discharge, red, okay, and armpit mass. So how to do breast self-examination? Just stand in front of a mirror, then tingnan mo kung may change of contour and any unusual changes on the breast, and then itaas lang yung kamay para ma-stretch lang yung muscles dito para maging prominent yung breast nyo. And then start palpating, okay? Palpating your breast. Don't use the tips of the fingers, use the flats of the fingers. Then kapa-kapa lang, covering the whole 4 quadrants, yung buong breast, no? And then after that, palpate the armpit. Yung pagkapa ng armpit, nakababa yung kamay para maluwag-luwag dito, makakapa nyo kung may kulani, no? Pag kinakapaing breast, usually nakataas yung kamay, ito. And then after that, the last thing to do is to press the nipple for any discharge. So basically, these are the techniques for breast self-examination. So what cost-effective diagnostic tests are usually done for breast cancer suspect, yung mga may suspetya? Okay, usually mammography, ultrasound, needle biopsy, and open biopsy. So may kanya-kanyang indications yan. No? Depende sa doktor, depende sa pasyente. No? So there are various indications for the diagnostic test. The choice will be dependent on the comparison of the options in terms of benefit, risk, cost, availability factors. So example of just comparison, ito yung biopsy. Okay, compared to the other diagnostic tests, in biopsy is the most direct way of getting the information. Kaya ito yung the best yield. No? Okay. Compared to ultrasound, mammography, CT scan, because these are just imaging and indirect tests. Okay. And then, but if you compare the risk, yung biopsy may konting pain from the needle prick, and then ultrasound, halos walang pain. Then for mammography, may konting pain kasi pinipisil yung ini-squeeze yung breast up between the 2 plates of the X-ray plates. Then may konting radiation. CT scan, may radiation, but there's no pain. So in terms of cost, usually the cheapest will be the ultrasound, and then mammography, and then biopsy, and then the most expensive is your CT scan. Okay. So depending on the availability in the community. What are the usual treatment of breast cancer? Usually, surgery is still the best. Kung maoperahan, usually it carries the best prognosis. Now, surgery is combined with chemotherapy and hormonal therapy and radiotherapy in some cases, I hope, but in most cases, because usually late dumarating yung mga pasyente for treatment. No? So, kung di kaya ng operasyon, then usually we start with chemotherapy, pinapaliit mo na, then after that, surgery, then followed by radiotherapy and hormonal therapy. Again, the choice will be dependent on comparison of options in terms of benefit, risk, cost, availability factors. Ito yung example of the yung how to choose the best treatment for a particular patient. These are the options, 1, 2, 3. Okay. Sabihin natin surgery versus surgery plus radiation or chemotherapy, radiations. Okay. So if the example lang ito, for option 1, if it has the greatest survival rate, then it's acceptable and it's only 5,000, then you choose this one. As this one, option 1 will be recommended. Kahit na ito 3,000, pinakamura, pero ang chances of survival is the very least, huwag niyong pipiliin ito. Okay? Yung pinakamura, pero hindi naman siya effective, you don't choose that one, that options. What is the prognosis? Okay? If you look at this table, yung cancer can be classified into stage 1, 2, 3, and 4. The most advanced is stage 4. Usually meron na sa baga, meron na sa bone, ganon. No? So you can see that the 5-year, 10-year survival rate, nagdi-decrease yan based on stage 4, maliit na. 40% na lang yung nabubuhay after 5 years. No? 24% na lang after 10 years. Ganon. But kung stage 1 and 2, usually 90% pa rin, 96, 93, no? Stage, ito kung 10 years, 89, 80.3. Mas magandang prognosis for those who are in the stage 1 and 2. Okay. The least, ang pinakapangit, those is stage 4. So the message here is to go for early recognition, diagnosis, and surgical treatment for breast cancer to have a better chance for cure and to avoid unwanted suffering and death. Okay. I emphasize here surgical treatment because at the moment, up to the present time, the surgical treatment still offers the best chance of cure kung maoperahan. Kaya importante, ma-diagnose early. Recognition of breast cancer survivors. Okay. I have a registry of breast cancer survivor. Okay. So, to better convince you of the importance of early recognition, diagnosis, and surgical treatment, and to inspire you, I will now present to you my registry of breast cancer survivors whom I've treated from 1982 up to the present, about 40 years now, more than 40 years. The criterion for inclusion in this registry is that at least 10 years in remission for a breast cancer treatment. Okay. Note, this is just a partial list because not all have followed up. So this list can be seen in these links. So at the moment, there are about 110 breast cancer survivors in the registry. Examples here, pictures. So some of these have lived are more than 40 years. So at most, at least 30. Okay, but some of them have 40 years in remission. Okay. So, summary and takeaway. Okay, I have presented all these topics, okay, as part of the Breast Cancer Awareness Month and also this focus content. Okay. And then takeaway in relation to patient empowerment, be always in touch with reliable medical information on breast cancer. Knowledge is power. It gives power. Use the 4 Ks of patient empowerment, kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions in medical management of oneself by knowing the fundamentals and generalities of breast cancer in your health management. So with that, I end my pep talk this afternoon. I hope I have empowered you to have an awareness or understanding of the fundamentals and generalities of breast cancer in your health management. Reminder, before we go to the question and answer portion, please take the OLETE, the 50 OLETE certificates. Obtaining 50 OLETE certificates will entitle one to a voucher for a free ROJoson telemedical consultation. And then feedback, please type in your feedback in the chat box before we end. Then let's now have a group picture taking. Okay. One. Ready? Everybody ready? 1, 2, 1, 2, 3. Pahabol. Okay, 1. Okay. Okay, kompleto na. Si Mel na lang. Mel Cabrera. Where, okay, Mel. Okay. 1, 2, 3. Okay. Okay. So the floor is now open for questions, sharing of experiences, as well as consultations if you may have any questions. Can you hear me? Okay. Any questions? Rex.
Good afternoon po sa ating lahat. Tanong ko lang, kasi naalala ko po, ang nanay ko nagka-cancer, pero prior to that pala, nauna po yung bunso nilang kapatid. Yung tanong ko lang, di ba po, ano po ba yun, parang genetics?
Ano?
Ah, yung cause ng cancer, isa po ay, ano po po yun, hereditary.
Hindi kita masyadong naririnig. Ulitin mo nga.
Ito po, ano po,
Okay. Okay. Ano yung question mo?
yung, kasi po, ano eh, parang nasa lahi po nila.
Okay.
Yung kasi yung bunso nilang kapatid, cancer, ano din, ang pinamatay. Mas nauna po yun, and then sinanay yung gitna na nagka-cancer.
May mga cancer na sa lahi, no? That's why inherited, no? Pero usually, yung talagang, kasi dalawang klaseng, what do you call that? Yung mga somehow related to the gene, no? Pwedeng yung tinatawag na inherited na gene. Merong gene na that will promote that is talagang that will lead to cancer. Pag napunta yung gene sa nanay o sa tatay, napunta sa anak, na sa babaeng anak, usually magkakaroon siya ng cancer. Talagang talagang inheritance 'yon, di ba? Okay. So, pero in terms of frequency, in terms of statistics, mga 5 to 10% lang 'yon, no? Maliit lang 'yon, no? Pero yung isa, the other type of na yung tinatawag na related to the inheritance would be yung family, no? Maraming because yung not because of the gene itself, but it's the family lifestyle. Pare-parehong lifestyle kasi nila, di ba? So kung pare-parehong lifestyle na parang exposed sila sa pare-parehong risk for breast cancer, kaya yung mother, sister, no? O yung anak magkakaroon, no? Pero the moment we start having a mother and a daughter, another daughter, kung tatlo na, most likely inherited na yon, no? Inherited na yon kung ganon, no? Kung isang, let's say, tatlo, no? Tatlong, pag dalawa lang, you can just say it might run in the family lang, no? So, so that means yung let's say kung meron pa isang kamag-anak na babae, no? Hindi naman talagang siguradong tatamaan 'yon. Hindi sure. Nobody knows, no? Okay. Pero pag yung inherited gene, most 99% tatamaan na siya, no? Okay. Ako ma?
Opo.
Oh.
May nagpa-follow up lang po. May nagsabi kasi sa akin, kasi nga alam po nung isang doktor na nagka-cancer yung nanay ko at yung kapatid niya. Tapos parang sinabi niya sa akin na possible din daw ako magkaroon ng cancer.
Iba ang sakit?
Ah, sinasabi po sa akin yung doktor na yun na dahil nga may cancer yung nanay ko at yung kapatid niya, pareho po silang namatay. Possible din daw po ako magkaroon.
Ikaw?
Opo.
Lalaki ka eh.
Hindi po, yung baka po tinutukoy niya, ibang uri ng cancer, possible po ba yun?
Hindi rin, hindi rin. Usually, yung mga ganon, usually yung parehong cancer. No? Okay. Pag kung lalaki ka, yung mother mo and then yung auntie mo died of breast cancer, okay, had breast cancer, hindi ibig sabihin magkaka-breast cancer ka and hindi rin ibig sabihin magkaka-cancer ka, no? It's not automatic, no? Okay, kahit na ang the most common cancer sa lalaki, ano ba yung most common cancer sa lalaki? Lung cancer, kung di ka na nag-smoke, no? So most likely hindi ka magkakaroon yan, no? So another common cancer sa lalaki, prostatic, no? Cancer, hindi rin ibig sabihin because your mother, your sister has breast cancer, magkakaroon ng prostatic, no? It doesn't really follow, no? Okay. So, but nobody knows, ha? Nobody knows what cancer we're going to get, no? Kaya importante, although our topic is on breast cancer, we have to be aware that nobody knows whatever, kahit na anong cancer pwede tayong tamaan eh, no? Okay. Okay.
Salamat po.
Okay lang? Meron kang follow-up question? Next.
Kasi po ba yung karamihan, mga older women na yung nadi-discover, matanda na. Katulad po sa nanay ko, matanda na po siya nung lumabas yung cancer.
Oo.
Parang ang isip ko, parang ang best na yung survival nila. Ganun po ba yan? Kasi matanda na na-discover, parang isip ko, parang mas mahirap makarecover or maging survival sila.
Okay. Hindi kasi number one, yung as I in my lecture sabi ko yung mga hindi mo makokontrol yung factor is the age, no? Pag tumatanda tayo, mas malaking chance na magkakaroon tayo ng cancer because we're so many years exposed to yung mga environmental factors which we cannot really exactly identify, no? But we know that they can be a cause for the cancer, no? Number two, remember yung age, sinasabi mong age, no? Doesn't mean na kung matanda ka, no, mas likely ang fighting chance mo, no? It all depends on kung nahuli mo yung cancer in an early stage kahit na matanda na yung pasyente, maganda pa rin ang survival rate, no? Maganda, no? So, in fact, I think nag-vlog ako the other day. Meron ako isang 86 years old, 86 or 84, 86 or 84, whom I operated on 2009, no? 2009, ang size of breast cancer niya 2.5 centimeters lang, no? So, inoperahan ko siya, tinanggal ko yung breast niya. Okay, after that, walang gamot, walang additional chemotherapy, walang additional hormonal therapy, walang radiation, just check up lang. Okay? So the other week, narinig ko sa mga kamag-anak, no, namatay na siya, pero she died at the age of 100. No? Nakalampas siya ng 100. So 14 years siya nabuhay, 14 years without recurrence. No? So, that's a testament na pag matanda ka na, wag mong gagamitin yung age as a reason for not having the operation, no? Okay? Kung maaga pa, no, tanggalin na kagad, no? Okay. So, ngayon kung talagang malala na, wala tayong magagawa, di ba? So, mas hihikli ang buhay niya kasi advanced na yung cancer niya, no? Okay?
Okay po. Last na lang po.
Ah,
Ah, kay nanay, pag binalikan ko, nagkulang kasi kami ng follow-up. Hindi na ko kasi kami agad yung nakabalik po sa inyo. Ang
mm,
alam ko po ang yung check-up namin sa inyo, parang nagpareseta na lang kami uli ng gamot niya. Tapos
oo.
yun na, kami nakabalik. Parang iniisip ko, parang may pagkukulang ako ng konti dahil na hindi na namin siya naibalik sa inyo. Pero based naman po dito sa kinuwento nila, sabi niya po, parang check-up na lang, bumabalik na lang po siya, di ba, na for check-up, pero hindi na lang medication. Pero nabuhay pa ng 100, umabot pa siya ng 100.
Actually, yung check is no guarantee also that there won't be recurrence, no? Okay. So yung advantage lang check up para kung may nag-recur, baka pwede pang magawa ng paraan. Yan lang, no? Okay. So itong kinakwento ko, 84 years old, no? So during the pandemic, wala namang check-up, di ba? Okay. So pero umabot siya ng 100 without recurrence, no? Hindi siya umulit, no? Basta tuloy-tuloy lang, no? Okay. So yung check-up is not a guarantee that there won't be recurrence. Ang advantage lang noon, nababantayan lang, no? Kung sakaling kasi kahit na magpa-check up ka ng kahit na monthly, pwede pa rin mag-recur, di ba? Pwede pa mag-recur yung breast cancer. Pero ang advantage lang noon, baka pwede pang maagapan, no? Okay? Ng doktor kung sakaling makita may recurrence, no? Okay?
Okay. Ito po, last na lang po, pasensya na po.
Sige.
Ah, Pwede po bang parang level ng, parang ganun ka aggressive yung cancer? Kasi parang, ang feeling ko yung kay nanay, parang ang bilis, parang ganun ka aggressive na.
Depende. Yeah, sabi ko nga kanina sa lecture ko, there are 20 different types and then even with the same type, iba-iba ang behavior. Yung iba mabilis, iba mabagal. No? Iba-iba. So eventually, it will be what I called only God knows. Di ba?
Okay.
Hindi natin talagang kahit na anong test na gawin natin. There are a lot of tests being done, no? Yung mga mamahalin na test, pero wala ring 100% assurance na tama ang information that you will get. No? Okay.
Okay po. Salamat po.
You're
Okay na.
welcome. You're welcome. Okay. Any more questions? Who wants to share some experience? Wala nang tanong? Ah, Mel, kumusta ka na? Long time no see.
Kasing signal sa probinsya kaya hindi ako nakakaano.
Ah, okay. Ngayon, andito ka na sa Manila.
Yes, Doc.
Okay, that's good. Okay.
So, yung isang tanong ko, Doc, like, as a cancer patient, talaga bang necessary na mag-undergo ng mga test every year, like bone scan, yung mga CT scan, ganun, Doc?
Hindi lahat kailangan, no? Example, yung 84 years old na kinakwento ko sa inyo, no? Wala naman siya mga test na ginagawa, no? Walang test ni isa, no? Basta check up lang, no? Okay. Kasi yung after a breast cancer diagnosis, let's say naoperahan na, no? Ang susunod naman yung surveillance, ang period of surveillance, no? Surveillance means imo-monitor kung uulit o hindi, no? Okay. So yung paraan yung pag-monitor, may dalawang klaseng pag-monitor. Yung isa based on walang diagnostic test, walang even mammography, wala, na? Okay? Basta examination by the doctor lang, no? And then also complemented by kung anong yung kapa ng sarili mo, no? Breast self-exam, no? Okay. So, yan yung tinatawag na symptom-based surveillance. Kung anong nararamdaman mo at kung anong nakikita ng doktor. Symptoms means yung ikaw as a patient, kung anong nafe-feel mo sa katawan mo, kung may nakakapa ka, no? And then, kung may nakapa ka, punta ka agad sa doktor, no? So, so wala nang mga test, di ba? Okay, and then, pag in-examine ka ng doktor, may nakitang walang nakita, pwede na yun, tapos na. Wala nang test, no? Okay? Kung wala kang nakapa, wala rin nakapa yung doktor, so tapos na. Ibig sabihin, clear ka muna, okay, at the moment, no? So, but subsequently, magpapa-check up ka pa rin. Pero pag may nakita yung doktor, then that's the time you might do some test, no? Like ultrasound, gano'n, no? The other approach is yung mga ginagawa ng marami, no? Is that every year, magpapa-ultrasound ka, magpapa-bone scan, no? Ganon, no? So, ako, I don't go for that, no? Okay? So, pero sa ngayon, maraming gumagawa niyan. Yung mga doktor, kasi ewan ko, baka mas gusto nila yung may mga test, no? Okay? Sa akin, pwedeng walang yung mga test na yon, no? Okay? Okay? Any more questions?
Sir, so, ibig sabihin, Doc, kailangan yung, kahit wala kang na, na, na feel na unusual, kailangan yung regular check-up.
Yung check-up with the doctor, yes, mas maganda. Kasi just to, para may peace of mind ka. May peace of mind ka, may tama ang ano mo, no? At ayan ang pinakamura kaysa magkakaroon ka ng diagnostic test, no? Okay. So actually I have one family of 5, palaging basta wala silang mga test, basta every year nagpapa-check up sa akin. You know? Parang parang annual PE, gano'n. Annual PE ang lalabas noon, na okay, na walang mga ultrasound, walang mammography. No, pwede 'yon, no? Okay. Kasi kahit na nagpa-test ka, pwedeng magkamali din yung test, di ba? Okay, pwedeng ma-miss niya. So, importante pa rin yung kinakapa mo sa sarili mo, no? Which you do monthly. Kung may nalaktawan ng isang test, no? At least kung lumabas next month, kasi yung test will be next year pa, di ba? Ang usually scheduled next year. Pag kinakapa mo sa sarili mo on a monthly basis, pag na-miss mo on 1 month, next month, siguradong mahuhuli mo na yon, no? Okay. Okay. Kaya importante yung monthly breast self-examination, no? Okay?
Okay, Doc. Doc, pwede isa pa.
Sige lang.
Go-wonder lang ako, Doc. Paano bang differences ng staging? Like stage 3A, B, C, ganon, D. Ano po yung kaibahan nila, Doc?
Number 1, yung stage 1, 2, 3, 4, they base it on the tatlong minimum of three factors, no? One is the tumor size, yung size ng bukol, no? Yung tinatawag na T, tumor, no? Okay? Then the other ones is N is kung merong lymph nodes o wala. Nodes. N is nodes, no? M is metastasis, yung spread, no? Malayo, yung lungs, gano'n, no? Okay. So, ito yung tinatawag na TNM staging. Ito yung pinaka-popular, okay, na staging system, no? So, pag meron kang M, no? Meron kang distant metastasis sa lungs, sa bones, sa liver, sa brain, automatically stage 4 na siya. Okay? Yung pinaka-advanced, no? Now, kung stage 1 means yung size of the tumor mo is less than 2 centimeters, no? 2 centimeters. Walang nodes, walang M, no? So, stage 1 yon, no? Then, stage 2, usually the N, yung T is usually 2 to 5 na. Yung stage 1, yung T noon, less than 2 centimeters. Yung stage 2, 2 to 5, mas malaki. Di ba? Then, stage 3, usually minimum is that the tumor is yung more than 5 centimeters na. Okay? Okay, T4, may isa pang T4, pag pumutok na, pumutok yung cancer sa balat, T4 yon, no? Okay. So with yung nodes naman, kung positive or negative, no? Okay. Kung positive ang nodes mo, automatically stage 2 ka na, hindi stage 1, no? Okay. So M positive ka, stage 4 automatically yon, no? Then N stage, at least stage 2, pwedeng 3 and 4, no? Pag stage 1, yung size lang plus no nodes, no? Yung mga A, B, and C, medyo magulo yon. May mga variations lang yon, no? Okay. Anyway, all this staging, guide lang naman yan. Every now and then, magbabago-bago yan eh. It all depends on the researches, no? Basta tandaan mo na lang, 1, 2, 3, 4, yun na lang, no? Basta wag lang umabot sa 4. Pag umabot ka sa 4, medyo tagilid na, no? Okay. Mas maganda 1 and 2. 1 and 2 pwede pa, no? Stage 3 medyo tagilid pa, pero it's not as bad as stage 4. No? Okay?
Doc.
Any
Thank
more?
you. Thank you for the clarification.
Okay. Any more questions? Lana? Breast Cancer Consciousness Month ngayon. Last call for questions. It's ilang oras na? 3 o'clock na pala. Okay, 3 o'clock pa lang naman. Wala na? If there are no more questions, we'll call it a day. Okay na? Sige. Next week, we'll be talking on lipoma. Lipoma. Okay. Konting difference lang sa breast, gano'n, na? Lipoma. Last time we talked about epidermal cyst, di ba? Ngayon, ipapasok natin lipoma. Okay. So, no more questions. We call it a day. We'll see each other next week again. Thank you for attending.
Thank you po.
Bye-bye.
Bye-bye po. Thank you po.
Thanks po, Dr. Ray.
Bye-bye.